Welcome, everyone. I want to thank you for joining us today. We have an exciting agenda for the call today. I sent out an email yesterday outlining what we're going to do, and we've got Bryce Ward, the economist, back. This is his third update for our group. Very grateful for his continued expertise in this. And then we'll move into Grace Decker, who's with United Way and the 0 to 5 program, talking about some childcare initiatives for our community. And we'll end with a roll call and some targeted questions associated with the content that you're going to be seeing. So with that, I'm going to move it over to Bryce. Are you there?
I am here.
You can share your screen and.
All right.
Oh.
All right. So I guess it's been a while since I've given a talk to this group. And in that time, so when I last talked with you, we were down in the trough of this little graph, which basically, is the COVID economy has kind of three stories. The first, there was a kind of month-long period of big decline, and then starting about mid-April, things started to get better. And then starting about a month ago, the things getting better kind of flatlined, right? We see that this is consumption based on credit card spending. We see the same basic pattern if we look at an attempt to try and measure employment contemporaneously. Big decline, bottoms out mid-April, starts rising, kind of flatlines roughly about a month ago. So that's kind of the basic story of the COVID economy. Nationally, in Montana, we've enjoyed the benefit of a smaller shock. So the left graph, that's the share of the population that was at work last week. And you can see the gray line for the US saw a big decline in April, and it's gotten better in May and June, which is last month we have data for. In Montana, we saw a smaller decline, and our gap between the most recent data in June and normal isn't actually that big. So that's a little bit better. Also, if you just look at the census's small business pulse survey, the share of businesses saying that they've had a large negative effect is much lower in Montana than we see across the country. So we've had a smaller shock, and it's also, at least people still think that shock is likely to be temporary. So this goes back to the CPS employment data. The graph on the left, that shows you the US, and just focus on, so the blue lines, those are things that are kind of temporary, right? That's people who are temporarily unemployed. That is, they think they're going to be called back to work at some time in the next 6 months, or they're absent from work. That usually means that I'm on sick leave or I'm on vacation, but in COVID times, it might mean a little bit something different. And those, of course, are elevated and have started to come down. The black and gray lines are the things that we are more concerned about long-term. Those are the share of people that are looking for a new job or have just literally stopped working or trying to be employed at all. And if you just look at the black line in the US, it started to creep up in the last month as more people have kind of shifted from temporary into I'm really unemployed and in need of a new job. When we look at those same data for Montana, we actually don't see a big increase in the share of people looking for a new job. With the imprecision in the data, I'd say it's basically constant. And the share of people who actually have dropped out of the labor force has actually gone down. Thus far, at least the data that we have suggests that Montana's economy hasn't started to see big permanent shocks, although our ability to measure that is certainly limited. And we have to, of course, keep monitoring as things go forward. So in terms of just trying to, that's all descriptive. In terms of trying to understand both what's happening now and what might happen in the future, there's four main stories that kind of come up, right? And these stories are all related, right? They, changes in one story ultimately can lead into changes in the others. But there's kind of four different pathways through which the COVID crisis can have an effect on the economy. The first one, the main one that's had an effect thus far, is people are afraid of the virus. Right? You can think of this as basically the virus raises the cost of doing certain things, particularly face-to-face services, and so people respond to that incentive and say, you know what, I'm not going to do as much of that. But there's also the potential for lack of income or job loss to lead to reductions in consumption, to changing preferences. As people establish new habits, they may not want the same things as they used to. And just like in, with, like, say, the dot-com bubble or the housing crisis, you get a mismatch between what people want and what we're prepared to build, and that creates friction in the economy. And then there's also just direct damage to productive capacity as a result, directly or indirectly as a result of the pandemic. So let's go through those a little bit more. Thus far, the main story is definitely fear of the virus, right? And not loss of income, right? So we look at that consumption graph. This is a version of that same one that I showed you earlier, but it shows spending by income. And amongst the lowest income quartile, there's actually hasn't been a decline in consumption relative to January or February. And as you move up the income ladder, the gap gets bigger and bigger. And if you look at income, now income has gone down. Lots of people have lost jobs, reduced hours. I think half of Montanans, or roughly half of Montanans, have indicated that they've seen their income fall. And so, yeah, you see declines in income. Those are the bright blue bars. But there's been a massive transfer program from the government that has more than offset the decline in income, at least as of a few weeks ago, right? And then particularly, it's actually increased incomes amongst lower income people, and that kind of then translates into what the story that I'm saying, which is that to the extent that we've seen a decline in consumption, that decline in consumption is largely driven by fear of the virus. People are consuming less face-to-face services, and that continues to persist. But the income effects of that have been, well, not perfectly muted because of mismatch between who gets support and who doesn't. But in aggregate, we've actually more than muted the effect on income, and that's kind of helped boost consumption to some degree. Now, that's the story thus far. Of course, a lot of these programs are scheduled to start running out or expiring here in the next few days or weeks. And so economists are very closely watching what's happening in the policy space in Washington, because if we don't continue to support income, those income losses are real, and those are certainly continuing amongst those who have lost jobs or reduced hours, and that will then ripple through the rest of the economy if we don't choose to contain that. Moving into the intermediate or the longer term, there's certainly a lot of potential that COVID is changing how people consume, what they want, how they work, where they live, and that can create real friction in the economy that we'd have to adapt to. Now, a lot of this is just there's a lot of think pieces of people speculating on what these things are. We're starting to get a little bit of data that hint at some potential for real change, but it's hard to say. Just a couple of data points. As of early June, about 3% of US adults had actually moved because of COVID. But most of those people, roughly 90% of those people, that was kind of temporary moves. Like, oh, I'm going to move back in with my parents, or I'm going to move in with a friend because I don't want to spend a period of social distancing by myself, or I'm a college student and I've been kicked off campus and so I'm going home. So only about 0.3% of adults, or 600,000 people, say that they've permanently moved. And while I think a lot of us feel that all of them have moved to Montana, we don't know exactly how many of those are here, but certainly to the extent that we've attracted or lost people, that has effects on our economy. Another big potential effect is remote work, right? So about 42%, or roughly 40% of workers have been working remotely, and about 80% of those say that they want to continue to do so in at least some capacity. Now, depending on how much that actually occurs and what actually works for businesses, that can have big ripple effects, obviously for things like office space, but also for the home space that you might want to be working in, where you live. And then there's further down the stream effects, right? So if more people are able to work flexibly from home, that actually changes the type of job that people will want. And that has longer implications for what kind of training and what kind of wages we'll see in different occupations. So the potential effects of COVID on our long-term trajectory of our economy are very large. But what we actually observe remains a bunch of a mystery. So the last story is damage to capacity, and thus far, it's hard to say exactly how much damage has occurred, but there's a little bit of evidence that some things are starting to occur that are certainly affecting our capacity in the short to intermediate term. We think that about 1% to 2% of small employer businesses have closed permanently. So that's not huge, but certainly, that adds up. And if you've seen my prior presentations, I've gone through in detail a whole bunch of different options, but, just a couple of things in terms of the human capital space. We obviously have a bunch of people that are getting sick, and not just being sick from COVID, they're also just the effects of being isolated and distant and, all the stress that comes along with it are definitely having real health effects. So if you ask people, to rate their health, the share of people who say that their health is only fair or poor since that trough in mid-April has increased by 25%. So, the share of people who say that they're in bad health has increased substantially. And also, we look at, indicators of mental health. And so that's what the graph on the right here is. And so, using the same questions, slightly different, but almost identical questions. In the first half of 2019, about 8% of people were showing symptoms consistent with an anxiety disorder, and 7% were showing symptoms consistent with a depressive disorder. As of the first wave of this thing called the Census Household Pulse Survey, which was done at the end of April, those had increased to 28% and 21% respectively. And in the 10 weeks that they have been surveying people since that period, those numbers have continued to steadily climb, right? So we certainly have some that sense of unease that you're likely feeling out in the world is certainly growing, and it's reflecting in the data. We're definitely having kind of health and mental health issues are growing. Another area where we're seeing damage to capacity is about half of parents indicate that their ability to perform work has decreased because of increased family and home responsibilities. We're seeing that in hours cutbacks, particularly by women. We're seeing that in more dropping out of labor force, again, disproportionately women. And to the extent that that continues or persists, that can have both short run and long-term effects on our ability to produce goods and services. Which kind of brings me to my, the theme of of this larger week, which is, how do we deal with kids? And it's timely because last week, a lot of the discourse in the media was about, schools. Can we, should we, how do we reopen schools? And throughout the whole pandemic, this notion of reopening has caused me a lot of angst because I think reopening frames the issue wrong while the pandemic is still ongoing. It kind of primes people to try and think of, well, how do I go back to doing what I was doing before when, while the pandemic is going on, what you were doing before fundamentally isn't really possible in the normal sense. It has to be adapted and changed and all that kind of stuff. So it's worthwhile trying to change the question a little bit and ask, the more fundamental question, which is how do we educate and care for our children? And it's worthwhile to note that I've separately included education and care because technically, of course, one can care for a child without educating them. And we have lots of technology that allows us to educate children without caring for them. So it's important to kind of keep them, while we normally use them to think of them together, we don't have to for purposes of trying to figure out the fundamental answer to this main question that we care about, which is how do we educate and care for our children? So to answer that question, of course, we have to ask, well, what do we need? What's required? What resources are required? And what do we have actually available? And then how do we actually organize it to achieve the best outcome possible? And then, of course, under normal circumstances, we have facilities, we have equipment, we have workers who are specialized in providing that care and specialized in providing education. The problem, of course, with the pandemic is that the threat of viral pollution in those spaces makes it so that we have to change and adapt, right? And so some facilities, equipment, workers are no longer available, or to the extent that they're available, we're having to modify them, and frequently we're modifying in ways that allow us to use that capacity less efficiently, i.e. we can get less care and education for the same level of resource invested. Thus, if our goal is to provide at least some semblance of the same amount of care and education, we're going to need more resources. So how much more and where does it come from, right? And in the spring, we kind of defaulted into we just kind of shoved the burden largely onto parents. And that created a lot of problems for parents. And so hopefully we been taking this time, and hopefully we will figure out, to the extent that this continues to go forward, a solution that doesn't just shift the burden onto the parents, because A, that's unsustainable for parents, and B, it's not going to get us to the best outcome that we're looking for. So to understand the magnitude of the problem, it's worth understanding just what role parents play within the larger economy. So 28% of Montana's labor force pre-COVID resides in a household with it where at least one member was below age 13. I'm going to use 12 and under as you probably have to provide at least some amount of care for them. There's a lot of ambiguity depending on the kid and the situation, but this gives us at least a rough sense. 22% of Montana's labor force resides in households with at least one member below 13, and where every household adult, whether that's a single parent, whether that's a two-parent family, or whether that's a multi-generational family, where every household adult is in the labor force or in school, right? So, and this varies a little bit by occupation and industry, but not much, right? So as a general rule, you can think of 1 in 5 of your workers is in a household with somebody less than 13, and every household member is occupied with work or school. So, and not, and therefore less able to provide care, and certainly less able to provide the level of education that's probably required. So what does it require to actually care for and educate these children? We have data from the spring that suggests in Montana, and it went down as the time progressed, but as of late April, households were reporting spending basically 2 to 3 hours per day teaching, and then an additional 4 to 5 hours in some sort of passive childcare. So that's a pretty significant burden. And of course, it varies a lot. If you have more kids, there was 2 additional hours in education. If you're a more educated parent, you spent 3 to 4 more hours a week on education. And if you have computer and internet available, you'll spend about 3 additional hours per week. And it's worth noting that only about 80% of Montana students have a computer or internet usually available to them at home. And of course, that's a big, significant time and effort. Parents are constrained, right? We don't have unlimited time. We don't have unlimited effort. Pre-COVID, about 60% of parents said that they felt used up at the end of a typical day. And pre-COVID, on days where they worked, people who reported having at least one person under 18, or actually under 13 in their household, they report only about 2 hours of leisure. And I put leisure in air quotes there because a lot of leisure isn't really leisure in that it's something that I can give up. A lot of leisure is rest and rejuvenation. It's basically just vegging out because I don't have the capacity to do anything else productive at this particular point in time. So it's worthwhile not thinking about those 2 hours as, we can just take those 2 hours and use them to provide care and education without any consequence in terms of health or capacity to work the next day on other measures. And so if there's only 2 hours of leisure available on a typical workday, and we're basically saying you got 2 to 3 hours of education plus 4 to 5 hours of care, you can see that the math doesn't really add up if we try and push this whole burden onto parents. Now, of course, when you face a resource constraint, people get creative and they have lots of options to substitute. And so we don't know yet what parents choose to give up. We do know that some parents have let go the quality or quantity of their work. We're starting to see some evidence of that in areas where we can actually measure output. Again, particularly we use this, we focus on women because they're the ones who have disproportionately seen burdens. And if you look at things like, this is the things that I've seen, the share of women who are submitting articles for journals for publication in the academic space has plummeted. But there's similar things in other fields. But of course, you don't have to substitute work. There's other things that you do with your time and effort, household chores, different forms of child care, elderly care, and to the extent you have resources, either financial or social, you can tap into those, and some people have done that. So we don't know yet what substitutions people make, but we know that something has to give when our normal child care infrastructure is not available or is operating less efficiently. And so we shifted into different into parents, and to the extent that they have options, they will use those. But what we do know from at least our experience in the spring is that there are definitely consequences to shifting the burden onto parents that have effects that will ripple through not just the quality of the education that that students receive, but also their parents' ability to produce productively in our community. And just as a final note, it's worth it figuring out how to tap into more resources to care for and educate children. So this is a new article that came out recently, which looks at the social returns to a whole bunch of social programs. And the graph here, basically the horizontal axis is the age of the beneficiary, who's being targeted. The vertical axis basically tells you about the social value of it. And you can see that to the extent that we have implemented and evaluated formally programs that target young people, the social returns tend to be very, very large. Now, this is of course pre-COVID, but to the extent that we're adversely affecting education and social outcomes for younger people, it tends to have very long-term effects. In fact, many of these programs are so beneficial that they generate additional wages, which generate additional tax revenue, which even if you discount them back into the present, is sufficient to more than pay for them. So they are actually profitable to the government to figure out how to provide this kind of stuff. And so that's my little soapbox on, and I will, of course, acknowledge my bias as a parent with 3 elementary school students, that we definitely need to figure out how to more efficiently to increase the amount of resources available and to more efficiently organize those resources, because the effects on both of our children, our parents, and our larger economy are definitely large. So with that, I will pause, and I think I have a few minutes to take questions before Julie will move us on to the next person.
I want to give time. That's a lot of information. As you digest it, think about it. Are there questions that come up? Clarification for Bryce? I will say, as a working parent myself, I found myself feeling validated by some of all that you were sharing. Claire, go ahead.
What a phenomenal presentation. A quick question. I love on that last graph in particular. Bryce, do you have a list of all those dots that are highlighted in that top left corner that you said those investments in particular are really the best bang for their buck? That just sounds like a really great list to have to see what's out there.
Yeah, so in the presentation slides that Julie sent around, there's a link to the article, which just came out like weeks ago. But so you can get, but if you look closely on the graph, they are labeled, like Head Start is in there, Medicare for pregnant and women and infants, or no, not Medicaid, sorry, that's what MC means. There's things like these preschool and I can't say it. It's just, it's a pre-K intervention. But yeah, there's essentially what these authors did is they kind of collected almost every benefit cost analysis of public programs that had an actual causally identifiable effect, and they then put them all together into a giant framework. And it wouldn't be surprising, given the authors, that if I went to their websites, there may even be a spreadsheet or something you can download which has the full list.
I just got an email that for some folks the chat might not be functioning. Feel free to either raise your hand or just chime in, come off mute, and I can direct questions that way. We'll just want to maybe 2 or 3 more minutes we have if someone. Lisa, go ahead.
Hi, this is Lisa from the Health Department. Thank you for your presentation, Bryce. That was awesome. I'm really interested in the return on investment with health, social health, emotional health. Do you think that article actually spells out dollar amounts that we can really wrap our minds around what kind of investments we need to shift our systems and our resources to better help our community?
Yeah, no, it's explicitly what it does. Is it takes the dollar invested and tries to figure out what the return to the individual and the value of that return, as well as the return to the rest of society, in terms of economists have all sorts of weird ways of valuing things that are hard to value, which of course are somewhat controversial, but sometimes it's better to have a number than not. And so, yeah, that's what they do. They basically go through and, either they or the articles that they draw from, the main contribution of this particular paper is putting them all together into a single unified framework, and making adjustments so that if you're trying to compare program X to program Y, and you've got two different articles, sometimes the authors of those different articles have made different assumptions or done things slightly differently. And so they're not actually apples and apples. And the key contribution of this particular article is to try and put everything into a single unified framework. And so while there's some fudging that has to go on to make that possible, you're at least comparing things on a consistent basis where you're counting the same things in the same way, at least to the extent possible. But yeah, it definitely gives you a dollar amount. The way that essentially that the vertical axis in that chart is basically dollar return on a dollar invested.
Got it. Thank you. That's very helpful because I think as a community, we have to really think about prioritizing our investments that's being very much pressured right now from every angle of our community at once, with
Absolutely.
This emergency over a long-term time.
Yeah,
so
no,
thank
right?
you so much.
When resources are scarce, this is when economists shine, right? We want to give you the most information about the trade-offs that you face, and you should be considering those trade-offs because you don't want to keep something that doesn't yield large benefits and cut something that does.
Bryce, I just have to thank you again. You have provided consistent data for us. That's been the whole objective of this group from the very beginning, is to frame this experience of COVID and the pandemic with data and action. And I just want to thank you again for putting all that information together and sharing it with us. And do you have any closing thoughts?
Happy to do it. If you have other questions, you know where to find me. And I'll hang out. And if somebody thinks of a question and wants to ask it later, I'll still be around.
With that, I'd like to get Susan Patrick and Grace Decker lined up.
Hello.
Hey, Susan.
Hi. As always, Bryce hits it out of the park. So it is my pleasure to introduce my colleague, Grace Decker. She serves as the coordinator of 0 to 5 Missoula, an initiative for which our United Way serves as the backbone organization. We work on the ambitious goal of improving outcomes for all young kids and their families and caregivers in our community. As many of you know, this is one of several collaboratives in Western Montana funded by Headwaters Foundation. Grace has a long background in teaching and early childhood education, including bachelor's and master's degrees in the field. She served as a professional development specialist and coach for childcare resources in Missoula, which focuses on strengthening the learning environments for kids in their earliest years. Almost 20 years ago, Grace was the founding director of Missoula Community School, and she's currently a trustee of Missoula County Public Schools. Anybody who works with Grace can attest that she is one of the most qualified and knowledgeable people in our community on early childhood in our community and state. And whether she's talking about our sort of broken early child care system or coming up with plans for a system for school-age kids, Grace is your go-to person. So take it away, Grace.
Thanks, Susan. I have to say that that paying attention to Bryce's presentation just now, I was feeling so fortunate to be following his excellent teeing up of so many of the issues that I want to share with you. Usually I'm the person who gets to share the piece of data that investments in early childhood pay off anywhere from $7 to $14 dollar for dollar. So that's an excellent start. So I wanted to talk with you a little bit about this question of what we as a community can do around care and education for our children during COVID. And I also really appreciated the way that Bryce pulled those two important components of what schools usually provide our children and our families, because we really are talking about a complex need, and we're going to need to be thinking about some complex solutions. So thinking about childcare with all hands on deck, I want to just share with you for a moment a couple of the things that you should know about our childcare system under normal circumstances. So as Susan mentioned, before COVID-19 arrived, childcare was already a broken system in many ways. The reason why childcare functions as a broken system is that the product, high quality care and education, costs too much to produce and provide than consumers can afford to pay. And yet it's an essential product, and it's one on which we really can't scrimp on the quality piece, because the experiences that young children have in those early years set them up for later success or later challenges. So it's a broken business model from the outset that has some really significant outcomes for families, for communities, and for providers. As anyone who has young children knows, childcare is really, really expensive. It's expensive to provide, and the costs can't really be cut. And so for most families in Montana who are having at least one child cared for in our child care system, we're talking about anywhere from 17 to almost 30% of a family's income easily laid out for childcare in a childcare setting. And then you can add to that cost if you're talking about more than one child. For many families, that means that once a second child comes along, it's time for somebody, usually the woman, to stay home and leave the workforce. And that's a tremendous loss to our communities and to our economies. And it's a really stressful and challenging situation for families. At the same time, even though childcare is so terribly expensive, there's simply not enough of it. There's not enough of it in any of our communities across Montana. The map that you're seeing on the screen right now is a map of what's called childcare deserts in the field. You may have heard that term before. It refers to the percentage of children in a community who could reasonably be served by the existing childcare capacity in that community. The counties in our state that are white on this map are counties where there is essentially no childcare to serve those families. Now, Missoula County is doing a little bit better. We have about half of the spaces that we need to serve families with young children. Some counties are doing even a little bit better than we are, but in no county in Montana can 100% of families who would reasonably be expected to be looking for care, is there enough care to serve all of those? At the same time as all of this is true, childcare remains stubbornly one of the lowest paid, highest turnover fields that exists. Childcare workers in Missoula County typically earn between $9 and about $11 an hour, which is not enough to support a family or pay for childcare for your own family. And so very, very many childcare workers and early childhood teachers are themselves recipients of public supports like SNAP and Medicaid, et cetera. This low pay and poor working conditions also contributes to significant turnover in the field. In many facilities, the turnover can be higher than 50% per year. And so quality in childcare is a little uneven, a little inconsistent because of that. So all in all, we're looking at a system that even before the pandemic was already a system that didn't really work very well for anyone involved at any level. So what happened during last spring's crisis? Well, when schools were ordered to be closed, the fact is that most childcare across the state, more than about 75% of childcare facilities, closed at the same time, because the concerns that that professionals had for children in school buildings apply also to children in group settings of any size and any type. And so most childcare facilities at that point did close, at least temporarily. Unlike schools, for childcare providers, when they close, there's no guarantee of any kind of continuing funding or continuing income stream. And so those facilities were placed at an extremely stressful situation. In fact, nationally, organizations like Childcare Aware and the National Association for the Education of Young Children estimate that up to 40% of existing childcare businesses may risk permanent closure if they had to stay closed for more than about 2 months. Most childcare, because it operates with such razor thin margins, don't have any ability to weather this kind of crisis and to weather this kind of closure and loss of income. In addition, facilities who did choose to continue to operate operated with very, very low enrollment numbers compared to their usual budget plans. So a facility that chose to continue to operate and serve the children of essential workers only, for example, might be operating with only 2 or 3 or 4 children instead of 12, as they usually would. And so their income would be cut dramatically, and yet their ongoing monthly costs for staff and rent would not have been reduced. And so that's a really difficult situation for those programs. Now, those things are typical for any businesses that were weathering some of the storm of the pandemic, but the supports for early childhood businesses and for childcare under normal circumstances were not sufficient to meet the need as of yet. There were some grants available through the governor's office, but those grants did not meet the ongoing costs that businesses faced, and also did not meet the ongoing costs of operating during COVID, which require higher expenditures. We found that because of increased need for staffing due to having to keep children in much smaller groupings, the increased cost for cleaning, both in terms of staff and supplies, the costs of operating during COVID-19 safely and effectively are anywhere from 150% to 200% what it costs to operate before COVID. During the crisis last spring, an emergency childcare task force began meeting, much like this economic recovery task force. Our goals at that time were to think about coordination among providers of childcare and coordination across our community to understand really what is the need for childcare, especially among essential workers and healthcare workers. How can we do a central referral to programs so that we're keeping children in as socially separated groups as possible? How can we coordinate around some of the really predictable needs that programs will have for things like supplies and ongoing scholarship support for families? We got ready to operate emergency care if needed, and we supported the emergency care that was operated at the YMCA and Boys and Girls Club, which offered care to essential workers through the spring. And then importantly, we started to think about how to help sustain our childcare sector and prevent closure of some of the childcare businesses who were experiencing the ongoing impacts of the pandemic. The task force continues to meet. We're meeting about every other week right now, and involves folks from these agencies and entities who you see on the screen here. We learned many lessons during the spring about emergency childcare and how emergency childcare does and doesn't meet our community's needs around childcare during COVID. And one of the most important of these for us to consider is what all of this means as we roll toward the school year and think about whether children are going to be able to be in their usual settings for care and education. Right now, the school district, MCPS, and other K-8 districts are making their plans using best current information about community spread and about how to return to the building safely and in what format. It's very likely that whatever decision each district makes, care and education is going to look somewhat different for our community, at least at some points during this upcoming school year and beyond. We don't need to know the exact plan to know that things are not going to be exactly as they were before. And the important point here is that when we talk about care and education for school-age children, you know, the system for 0 to 5 early childhood childcare is broken, is stressed, is inadequate, but it exists. When we're talking about a system for school-age childcare during the school year, that's a system that doesn't yet really exist. There aren't providers who offer care and education during the school year in a robust kind of way, other than during after school and holiday hours. because schools pick up those pieces in our community. So the system really doesn't yet exist. And the challenge is extremely complex if we are to think about how to support families, encourage economic opening and recovery in our community in ways that don't increase the likelihood of the virus being transmitted across our community. How do we work in a coordinated way to achieve some really important goals? Over the spring, in the Emergency Childcare Task Force, and in some statewide coordination work that's been underway through what's called the VOAD, the Volunteer Organizations Active During Disasters, which is a lot like our COAD structure locally. This is a statewide structure. We've come over and over to the point that coordination is going to be really key in all of these efforts. We need to think about community coordination around the childcare question to make sure that anything happening around childcare does not interfere with the kinds of health and safety outcomes that schools are taking so seriously and how they set up their structures. In other words, if children are spending their days in very small, consistent cohorts in their schools, it's important that those same children participate in out-of-school time together. Children enrolling into after-school programs from across the community will bring together social mixing in ways that will negate what's happening at the schools unless we're coordinated. We also want to make sure that we're providing equitable opportunities for this kind of care to families all across our community. We know that there are many families and many neighborhoods that are already starting to think about what they individually or in very small collectives can do to meet this need, this predictable need. But there will be many families who don't have those resources, who don't have the ability to be supported by each other in that way. And so as a community, we can come together to think about this equity question and make sure that we can create equitable community solutions that really also use resources effectively. If each business, each school, each family is solving this problem in isolation, we will likely be using resources in a much less efficient way than if we do this in coordination. So you may have already heard about some kinds of solutions that are being bubbled up and that are emerging at the community level, right? I've popped some of them onto the screen here. The important thing to realize is that there's not likely going to be one solution to the question of how we care for and educate our children. There are likely to be many, but it's our job, I believe, as a community to think about how we can support these efforts in ways that push toward our top level goals of health outcomes, equity, and using resources efficiently. Coordination, again, is going to be key with at least school districts and ideally with other community organizations as well. And as we coordinate together, we can think about mapping in our community, where are the places that expertise lives that can support this work? Where is business expertise? Where is the care and education expertise? Who are the people who can be brought together to be the solvers? What are the facilities that we can bring together to address this challenge? Are there locations? Are there support structures? Are there ordering capabilities? What are the kinds of facilities and what are the sources of support that exist across the community to bring together a network of solutions in a coordinated way? We've been looking at the need for funding around this challenge. This is obviously not unique to the Missoula community. We have been locally and also at the statewide VOAD table, developing a picture for what a funding structure might look like to support coordination work in our local communities. And then as we support coordination work, we bring many different kinds of partners who can actually provide care to support what's happening in the schools. I mentioned that this was really complex. The main question that I want to ask you to think about really, and that I'm really grateful for the opportunity to share with you, is where you and or your organization might see yourselves in this solution, might see yourselves in helping build a community solution. The First 5 Years Fund is a national advocacy and policy organization dedicated to childcare and early education. And the quote that's on your screen right now is as true here in Missoula as it is anywhere else. that our long-term well-being is really going to depend on our childcare infrastructure working for families and working for businesses. And I hope that all of us in our community can see ourselves as part of that solution.